Good afternoon, everyone, and I'm delighted to welcome to the last session of today's CleanMed. Today, we want to continue our conversation that we started on Tuesday, and specifically Policy Pipeline Part 2, Bridging Policy and Practice to Advocate for Sustainable Action in Healthcare. And before we start, I want to mention a few things that you will probably know by heart right now. So please be aware that this session is being recorded and it will be available to watch in a little bit. Then also be aware that there is a live chat on the right side of your screen, and there's a Q&A tab where you can send questions to speakers. If you want this question to be asked by someone, that I ask it to someone specific, please also mention their name. And then also be aware that if we don't manage to answer all your questions, the speakers will be available maybe to answer them directly in the chat, or you can also always contact them afterwards in their profile. Having that said, I'm really, really excited to welcome my first speaker on screen. This is Susan Wilborn. She's a senior consultant and a historic figure at Healthcare Without Harm. She was already involved in Healthcare Without Harm from its early days and played a key role in shaping its global programs. She has a background in occupational environment health and has worked on mercury elimination, sustainable procurement, waste management across more than 20 countries. She worked for around 10 years at the World Health Organization, where she led programs on worker safety and hospital sustainability. And she's now a member of the Bureau representing the Health Civil Society on the Global Framework on Chemicals. Welcome, Susan. And then I already go on to my next speaker, Marie Jung. Marie Jung is a research associate at the Center of Planetary Health Policy. She focuses on air quality and environmental justice, and both on national and also sometimes EU context. And she leads projects on the EU Ambient Air Quality Directive in Germany, and she works cross-sectional coalitions for planetary health. Welcome, Marie. And then last but not least, Antonia Herzog. She's also someone from the Healthcare Without Harm family, but from our US team. She's the Director of Policy and Advocacy in the US Climate Program, and she leads the federal strategies for climate smart health policy. Before joining us at Healthcare Without Harm, she did work advocacy for the Natural Resource Defense Council. And she also holds a PhD in physics from San Diego and additional degrees from Columbia, Dartmouth, and Vassar. Happy to have you, Antonia. So then we can already start in. I want to start with you, Susan. You began advocating for occupational health protection early in your career. And thanks to your efforts, it was eventually adopted to a global strategy. Can you tell us a bit about that journey, and please elaborate?
Thank you, Clara, for the introduction, and it's wonderful to be with you today with CleanMed Europe. Hello to colleagues. I got started in global policy work after working for over a decade on national policy, and particularly with the American Nurses Association in the United States, and then globally with the International Council of Nurses. And my very first meeting advocating for global policy was a WHO meeting for the Safe Injection Global Network. And at the time, the whole programmatic area on safe injections meant safe for the patient, safe for the worker, the health worker, and safe for the planet or safe for the environment. And at the time, the focus was really on patient safety and on children's safety. And I went to my first WHO meeting on behalf of Healthcare Without Harm and the International Council of Nurses in order to advocate for the two pillars of that platform, safe for the worker and safe for the environment, that were being, I would say, underrepresented. And as I sat in this first meeting and trying to speak up, knowing that I was representing a perspective that wasn't being shared. I noticed that some of the speakers had data about health worker immunization against the hepatitis B virus, but they weren't presenting that data. And I started asking questions during the session about, well, how many health, this was about immunizing children against hepatitis B in order to prevent hepatitis from unsafe injections. So I started asking about health worker occupational health, and I started asking about the eventual waste treatment technologies for the syringes at the end, since both of these issues were key for healthcare without harm and for nursing organizations. And as a result, the organization began to shift and recognize that these were key components in the principles that weren't adequately addressed. And through that work, I often talk about the environment of care, the environment of caring in healthcare settings being the same as the environment of work for health workers. And protecting patients meant one also had to protect health workers, and that both had a great impact on the environment as a whole. And certainly this issue of, at the time, throughout the world and including in the United States, the burning of healthcare waste was a contribution and one of the founding incentives for the creation of healthcare without harm over 25 years ago, that healthcare waste burning was one of the leading causes of dioxins production in the United States. And so in order to manage health worker safety, patient safety, and waste management to protect the environment as a whole, I learned a lot from my colleagues within Healthcare Without Harm, and as an advocate for worker safety, became a broader advocate as a whole. And that work at that time led to the development of the Stockholm Convention on Persistent Organic Pollutants, now many, many years past, and further the creation of the health sector strategy for what was SciChem, the Strategic Approach to International Chemicals Management, and also eventually the Minamata Convention on Mercury. So the advocacy of a health perspective in those areas was critically important.
Yeah, maybe about that. So exactly as you mentioned, you're now working on the global framework for chemicals as a member representing the Bureau in Health Society. Could you briefly explain exactly what this global framework for chemicals is about and how you can engage the healthcare professionals in this new context? And what you maybe learned from your past experience and applying now.
And still learning. The Global Framework on Chemicals is a very, very interesting international instrument, and it's unique and interesting in a number of ways. One way that it's important is that it includes ministries of health, ministries of environment, ministries of labor, and ministries of agriculture who all come together. So it's a multi-stakeholder, multi-sector body where everyone is looking at the management of chemicals. So SciChem, as I mentioned before, the Strategic Approach to International Chemicals Management, 2 years ago through the International Conference on Chemicals Management, was succeeded by the Global Framework on Chemicals. And the Global Framework on Chemicals is for a planet free of harm from chemicals and waste. So it's recognizing that all of these agencies of the government that I've mentioned are important to protect the planet and the health of people from chemicals and waste. But it also is unique in that it is not just governments that get to speak at meetings. The civil society representatives, and as you mentioned, Clara, I represent health sector civil society on behalf of Healthcare Without Harm on the Bureau of the Global Framework on Chemicals. Civil society gets to speak with an equal voice at the table. So in a week after next, when I go to a global framework on chemicals meeting in Uruguay, it's the open-ended working group in the preparations for the international conference that will occur in 2026. When we go together there will be civil society representatives from public interest groups, and that's the International Pollution Elimination Network and the Pesticide Action Networks. The trade union confederations will be there, the International Trade Union Confederation, and myself representing Healthcare Without Harm and health sector civil society with other World Federation of Public Health Associations. So we go together, and when we put our flags up to speak at this meeting, we will be taken in order that the flags appear. It's not governments first and then civil society if there's time later. We speak with an equal voice, and there is this very interesting collaboration across stakeholders of labor, health, agriculture, and environment. And this work that I'm doing came as a result of the work with WHO on health and environment. And then as part of, you mentioned that I went and I worked within WHO for a number of years, and that was during the time that WHO was doing two things. They created a roadmap on chemicals, and they worked with UN Environment to develop the health sector strategy for what was then the strategic approach to chemicals management. And so as part of my work at WHO, I was involved with facilitating civil society to participate in the creation of the health sector strategy, really important for government's action on health and chemicals. And then also, as part of my work with Healthcare Without Harm, facilitated civil society involvement in the development of the WHO chemicals roadmap. And I'll talk a little bit more about that later, perhaps, because the chemicals roadmap is now in revision, and it is an opportunity for Healthcare Without Harm and civil society in health to participate in that revision.
Thank you so much. Really, really inspiring and interesting to hear from all your work. And I think especially like having your voice there as a nurse gives you even more more weight to your voice in these conversations. So that's really inspiring. But I also have, of course, really interesting other panelists. And I now want to ask Marie. So as a research associate at the Center of Planetary Health Policy, you worked on campaigns around air pollution and public health. And I wanted to ask you if you could share a bit about your work, the Center for Planetary Health Policy, where you work, and also your role, the role of healthcare professionals in this space. And it's yours.
Yeah, thank you. And thank you also for organizing this event and inviting us from CPHP to be part of it. And I'm very happy to share some experiences of my work. So at the Center of Planetary Health Policy, we have, we had one project on air pollution in the past, and we are also having a follow-up project that started just last month, both funded by the Clean Air Fund. And in this project, like in the first project, we supported the revision of the Ambient Air Quality Directive at the EU level that aimed to get stricter air quality levels within the EU. And at the end of last year, the revised AQD came into force. And during the first project, we tried to examine the role of the German government in the revision process, and we also wanted to foster collaboration between various actors to advocate for stronger air quality guidelines. So for this purpose, we organized several events where we brought together actors from science, but also from environmental health organizations and from the political and administrative level to raise awareness and to exchange experiences and expertise and to emphasize the importance of stricter air quality guidelines. And now in the current project, we want to support the two most polluted regions in Germany in the implementation process of the revised guidelines. And this time we also want to involve national health policymakers and public health organizations, but also those stakeholders that remain often unheard, such as patient groups, social welfare organizations, trade unions, and healthcare professionals, to give them a voice and to also get into contact with them and engage them to advocate for cleaner guidelines. And we also want to find out from them if they already see effects during their daily work. For example, if they have patients that are already suffering from, and then also if they already, talk about how patients can protect themselves from bad air. And then we also want to exchange knowledge and experiences on how we can gain acceptance for measures which might also restrict some patients or people in general. And that's why we try to involve them as good as possible and get them together with policymakers and decision makers in networking events.
Yeah, really, really interesting. And maybe now this is like, and now just on top of my head, but your organization is also in close collaboration with Klug and CleanMed. So maybe you can just tell a bit about these two structures and how you fit together.
Yeah. So I think like at the CPHP, we often are more like looking at the structural and regulatory perspective. So, for example, how regulation can be changed so that healthcare becomes more sustainable. And as you mentioned, Klug and CleanMed, our partner organizations, they often have projects more kind of hands-on and in where they are more directly in contact with healthcare professionals. So, for example, we just recently started a project called the Glove Project, where they consult healthcare professionals to find out how behavior of healthcare professionals when using gloves can be changed so that they can save resources in their daily work. And there they really do workshops with healthcare professionals directly, and they really want to find out, how they can change their behavior in their daily work without losing quality. So while we are more on a, I would say structural level, our partner organizations are more directly in contact with the healthcare professionals.
Yeah, and maybe for the people at home that don't know, Klug and also CleanMed are strategic partners also of Healthcare Without Harm. And for example, where we can see maybe how global collaboration or events like this help. For example, the gloves campaign that's now happening in Germany has been inspired by some of our partners from Gosh, from London, that are also part of our network. So there we can see where like effects in one country can also inspire action in another. So it's a really great example. So thank you, Marie. And now one question to you, Antonia. You're joining us from the US, from Washington, D.C., and where we all know the political environment is particularly complex. Despite this, you have also had success in the past advocating for climate neutral and resilient healthcare systems. And I would ask you now, drawing from your work in the DC, what strategies have you found to be effective and what enables health professionals to shift awareness to impactful advocacy?
Thanks so much, Clara, and for inviting me to join the panel here from the U.S. In the heart of policy, federal policy making. So I have been working on federal climate, clean energy, and clean air policy now for over 2 decades here in the U.S., starting at a very large national environmental nonprofit organization, and then, as you said, moving here to Healthcare Without Harm in our U.S. program to bring that experience to bear on promoting policies that will help healthcare systems become more sustainable here in the U.S. Now, of course, so I've been through many governments, let's put it that way. This is only the latest version. The key, I'm going to take a step back, and the examples that have been discussed fit in very well to this, but just sort of taking that step back, because the U.S. is a specific type of government, our healthcare system has a specific type of structure, and other countries have different types of governments, and their healthcare is structured differently. But I think there's general approaches and lessons that can be learned that apply everywhere for healthcare professional input and action around policy and advocacy. So in principle, what are we trying to do? We are trying to implement policies, but how do you go about doing that? Well, you have to influence policymakers. So that's the key that is general across all of our countries and places of work. So identifying who those policymakers are is paramount, and then figuring out how do you influence them. Now, there's a variety of ways of going about doing this. Again, no matter what your government structure per se is, nor what your healthcare, how your healthcare is structured. So first of all, you as healthcare professionals, be it sustainability managers, physicians, nurses, pharmacists, public health, etc., you can directly communicate either as an individual or as a group to a policymaker. So that's number one. But you can also influence policymakers indirectly, and this can be just as powerful. Now, how do you do that? You have to determine who does a policymaker care about? Who do they listen to? The media. That's they all listen and care about press for the most part, no matter what government. They care about big business in your countries. Even if your health system is a public health system, the pharmaceutical companies, for example, are entities that have enormous influence. So influencing those influencers is something that health professionals can do to impact policy. And then, of course, just general public education and public pressure. So healthcare professionals have been shown to be some of the most trusted public messengers. Both here in the U.S., we have data showing that our primary care, our physicians, are the second most trusted public messengers after first responders like firefighters, and then climate scientists come after that. So there is a really important role that healthcare professionals can play. And I'd like to pop into the meeting chat here a very recent article from an entity here in the U.S. called George Mason University Center for Climate Change Communications. How you communicate around climate and healthcare is very important. So what they find in this article is that the public understanding of the climate-health connection remains low, unfortunately. Climate health framing, however, once it's understood, can really increase support for collective action. So educating those around you, people you know, as well as policymakers, that you are trusted messengers for climate and health information, and that you can raise public awareness. So that is a good article to look at. It's behind a paywall. Maybe you have access to it, but there is a summary there. There's another important group here in the U.S. that does climate messaging work that I wanted to highlight, Yale Program on Climate Change Communication. They have, and pop this into the chat, please, they've just released recently a tool where you can put together fact sheets by country that includes measures of public climate change knowledge, risk perceptions, policy support, etc. And this is all around the globe. So I think this could be a really helpful tool for your work as you consider public policy advocacy. Quick couple of examples of what we've done here in the US that I think can translate. We have done campaigns, letter writing campaigns with health professionals to try and influence policymakers. For example, there's an accrediting body in the US that's actually also in Europe called the Joint Commission, where they were putting forth sustainability measures around climate change. And we had just heard that they were about to weaken them substantially and make them voluntary in particular. So we organized and over a weekend got 750 health professionals on a letter that we sent to the Joint Commission pushing back on that. So that's one example. Another example of ways to bring in others that can influence policy. Again, there's a translation over to Europe. We've been talking to companies like AstraZeneca, a big pharmaceutical firm, trying to push them to put forth more climate-friendly inhalers. So again, they have an enormous amount of influence themselves, and we are trying to influence them as healthcare professionals. So those are just two quick examples, and happy to talk about more, but I'll stop there.
Thank you so much, Antonia, and thank you, first of all of you, three of you, to have like this first a bit bigger question. Now I would like to translate more of a discussion and then also afterwards open us up to the attendees. And here I would also ask you, so what helps healthcare professionals to move from individual action to collective advocacy? So what are maybe some strategies? But before that, I also wanted to actually just answer on you, Antonia, that sometimes something similar we just did like 2 weeks ago, where Healthcare Without Harm shared a letter to sign about PFAS in medical devices. And PFAS is a chemical, a so-called forever chemical that is really highly used in medical devices, and it's known to be bioaccumulative and also many of them toxic and also for our reproductive system. So we wrote the letter together with healthcare professionals and then shared it around our networks, and we send it to the Commission, and it's being hopefully considered. Let's see, but basically the Commission is right now thinking about regulating PFAS, but there's a lot of counter lobbying of not letting that go through. So it's always important, and your voice really matters. And if we have your voice with us, then we can really advocate for stronger action. So, but having that said, let's come back to our question. So maybe you can all think about, maybe let's start with you, Marie. So what helps healthcare professionals to move more from individual action to collective advocacy? Like, do you have some tips, maybe some networks you know of in Germany or things, but also if not, feel free to just give the question to one of the others.
Yeah, thank you. So like at our organization, we often talk about decreasing our footprint, but more importantly, increasing our handprint. So as Antonia has already mentioned, there are several different ways on how healthcare professionals can become active. And one level to start with is, of course, the individual level, where they can change their behavior. But then we also need them to engage also on local activities. For example, in Germany, there are green hospitals where, that kind of have a pull factor for healthcare professionals, as the working environment, can be just more, just better for them, more interesting, and they can maybe develop better and pursue their interests. And then there are also activities on a more politically level, like it can start with just to participate at demonstrations together with other healthcare workers. So, for example, in Germany we have the Friday for Future demonstrations, and we have the Health for Future group where, in different cities there are networks, and they always go together to the demonstrations, and there they want to advocate for their interests. But then we also have the opportunity to write position papers and send them to ministers, for example. And at Klug, we have already written several position papers, for example, from the Midwives for Future group, but also from occupational therapists. And then we at the CPHP, we try to always, get their points of views together with the policymakers, so that they can engage together and find solutions together. But I think it's really important for policymakers to kind of present those platforms where healthcare workers have the chance to get in contact with them. And then we also need to develop mechanisms on how decisions that are made at different platforms, or for example at the German Medical Association, how they are then really put into practice, because they have made great resolutions at their events, but if the policymakers don't really accept them or don't put them into policies, then it just keeps to be a voluntary or individual solution, but we need to really put it on a broader scale.
Yeah, then maybe Susan, you have maybe like also long-term experience, and now you're also trying to involve healthcare professionals in a global framework of chemicals. Maybe you can explain a bit there how that works and how maybe people can also engage if they're here.
I've been thinking about what both Marie and Antonia have been speaking about, really helpful and useful. And I wanted to add to what Antonia was saying in terms of influencing policymakers about how important it is for health professionals to speak up, and it's often difficult. So thinking about through the organizations, like Marie's organization and like working with Healthcare Without Harm, to get support for and more knowledge about, to prepare yourself to speak in these political fora, and even to practice together as a group, because it is so important that health professionals can talk about what are the health impacts and how important it is for policy to include health. And I was thinking about what you were saying, Clara, in terms of the sign-on letter about PFAS, and how when we're advancing policy initiatives, often the policymakers are a bit afraid of healthcare in general. You know, hospitals smell funny, there's sick people there, policymakers think about their own family members who have been in the hospital, and it's frightening to think about it. So they're ready to accept from especially the industry of healthcare to exempt healthcare from a policy, like a policy on eliminating PFAS from products. And I think one of the really important examples of how, as you were saying, Antonia, in influencing influencers, that related to the plastics treaty. At the very beginning, the first articles in the plastics treaty, which final negotiations will be in August in Geneva this year, the first language was to exempt healthcare from the plastics treaty in general, and then to try and build some exemptions for health products. But it was health professionals through Healthcare Without Harm who said, no, this is especially important in healthcare because these are endocrine disruptors. These are long-term health, there's long-term health impacts. We must include not only health as one of the issues, because there's health effects from microplastics and health exposures, but also health products should be leading by example to eliminate unnecessary toxic plastics in healthcare. And because of our efforts, WHO became strengthened to be able to repeat the same message and to say, wow, if health is exempted from the plastics treaty, it will thwart innovation in healthcare. So even more reason why we need to be included.
Yeah, and maybe you, Antonia, like thinking about influencing influencers, but also about what Susan just said about the plastics treaty. Can you maybe a bit elaborate of why it's important to frame the environmental crisis also as a health crisis and how that can help us? And yeah.
Yeah, sure. And the example Susan gave was such an excellent example. We here in the U.S. also engaged on that, working with our health professionals and health systems to also write a letter to the U.S. State Department on this particular point, pushing them not to exempt healthcare from the plastics treaty. So we'll see how that plays out. But there's a lot of the opposite side that's pushing very hard, and you have to push back. So, I mean, that's my message to everyone. Don't give up. You have to keep on trying. You can't just leave a vacuum. So, with respect to, how health professionals can get involved, I would just like to go back to the influencing the influencers, because that's our niche at Healthcare Without Harm. In the U.S., we have a private system for the most part, and so we try and push them to be better on sustainability and uptake those solutions. But sometimes, like, what are the policies that are going to help them or push them to do the right things around sustainability? Some of them are good actors. Many of them are not. So one thing is, remember, your voices are very powerful within the institutions in which you work as health professionals. And so finding your like-minded people, sometimes you can just do that organically within your institution. Sometimes, join an organization like Healthcare Without Harm, where we have those networks already set up. In the U.S., we also have other organizations which are just more focused around health professionals as individuals and less focused on the healthcare sector, like Healthcare Without Harm. But there's also, I'm sure, organizations like that elsewhere around the world, bringing health professionals together to talk more personally and directly about those impacts. Look for groups to join is my first suggestion, and then take those groups and start organizing them to create pressure on your institutional leadership to do the right thing. If you create that kind of pressure, we have seen this work. People listen. Your healthcare institutions listen to the physicians within their walls. Write a letter, set up meetings with leadership to talk about the type of changes that you want to see and those policies that can support them. That is a very powerful way to start this journey.
Oh, wow, that's really inspiring. Thank you so much for that. Just one last question, because we're running out of time. But to finish, I wanted to maybe, what is giving you hope right now in maybe this bleak, sometimes news cycle, and especially in sustainable healthcare? First to you, Mary.
Yeah, so I think what gives me hope is also, like Antonia said, that I feel like in Germany we've been able to create those groups of, for example, of midwives, of physiotherapists and different healthcare professionals, and they are now more heard than in the past, or at least that's what we have realized. And for example, just last week we had a heat day in Germany, and we started the heat day a few years ago, and it always has, the attention for this day has always risen. So now we are in the news, and people are talking about this issue, and that's just giving me really hope also for the future, that we can also get not only attention for heat, but also, for example, for air pollution and other important issues. And another thing that gives me hope are the small successes, like, for example, with my project, that we've managed to really get stricter air quality guidelines. I mean, now we have to implement them on the national level, but at least, the EU has decided upon them, and we've seen in the past that those guidelines, they work. Like, the air has increased in the past decades, and we can still do progress, and that's really what gives me hope for the future.
Oh, thank you so much. Also, just to link myself in, yes, like if you're healthcare professionals, please join local networks in your state, in your city, in your country. And then, of course, on the European level, we also have healthcare networks. So we have the Doctors for Greener Healthcare, we have Pharmacists for Greener Healthcare, and we have the Nurses Climate Challenge. So please, if you can find them on the Healthcare Without Harm website, and there we also share our initiatives and try to do good together. Antonia, what is giving you hope?
Sure, and I firmly believe you must never give up hope, no matter what's happening. So obviously it's very, very challenging times in the U.S. right now. A lot of the good work that had been accomplished in the last 4 years is being undone, and it's very distressing and very problematic. And I can't say how it's going to play out or how it's going to influence the future. But what gives me hope beyond that particular bleak prospect is frankly Europe. You guys are doing a lot of amazing work, and I'm looking to entities like the countries that you're from and Europe as a whole to really start to lead the way in this space. You can do it, and you are already doing it. And you can, put what's happening in the U.S. aside. Don't focus too much on that. Do the work where you are and make a difference. That is what gives me hope, that you are going to step into the void that the U.S. is now creating.
Oh, wow. Okay, then last but not least to you, Susan. What is giving you hope? Oh, you're muted. Oh, Susan, you're muted. Still?
Oh, sorry. I agree with Antonia that it is necessary to always hold out hope and look for small successes that will propel you and give you energy to continue to work. And for me, I feel hopeful in the interaction with my colleagues within health and outside of health, and how we find partnerships across organizations and common cause to work together. I also find it hopeful working with policymakers who really care about doing the right thing on behalf of public health, but don't necessarily have the information in order to do so. And by engaging with policymakers and providing them information and good practice examples of where already, let's say in the case of PFAS, where we've already eliminated PFAS from medical devices in my particular healthcare setting, in my hospital. And that's the other place where I really gain strength and hope, is all of the case studies from the Global Green and Healthy Hospitals Network across more than 80 countries that demonstrate the elimination of unnecessary plastics, that demonstrate reductions of waste, and how we learn from each other across regions, and especially learning from that Europe and the US can learn from the work in Africa, where African health professionals have really good relationships with policymakers and can learn from Southeast Asian colleagues about eliminating unnecessary products and the plastics audits that have gone on. So just being aware, being curious, and connecting with others who are working to gain strength and momentum.
Okay, and with this, we are sadly already come to the end of the session. Really, thank you so much, the three of you. It was really a pleasure and really an insightful discussion. And also thanks to our audience today for joining us. I encourage you to continue the conversation in the chat or connect with our speakers, but then also see you again tomorrow because that's the final session of day 2. And I look forward to seeing you tomorrow, especially we have the keynote of Professor Karl Mons tomorrow tomorrow morning at 10 a.m. Europe, Brussels time. And then also there will be another highlight sessions coming up. Don't miss Is Europe Ready to Produce Cheap and Green Medicines tomorrow at 15:45 Europe time. And then on Friday, another of my sessions. Well, we have to moving away from PBC, why it's necessary and how it's achievable, as well as another great workshop, Myth-Busting Sustainable Healthcare, which begins tomorrow at 5:45 and can be accessed via the workshop tab on the screen. And with that, thank you again for being today at CleanMed Europe 2025 and see you hopefully tomorrow.